Welcome. So glad to have you today here, Dr. Tim Hoffmeister. We'd like to welcome our guests to She Speaks Solutions present Mental Health Matters. And today we're just going to take a real good look at the cannabis industry and everything that you should know. I'm going to go ahead and let you introduce yourself to our audience and let them know a little bit about you, and then we'll get right into the questions of the cannabis and the industry.
Great. My name is Tim Hoffmeister. I'm a DO, trained in obstetrics and gynecology, and did that for about 15 or 20 years or so. Had a back injury and pivoted away from full-time OBGYN due to discomfort and things like that, and had to find a job where I could sit down, and quite honestly is how I stumbled into cannabis. It turned out it really helped with my back as well. So initially coming to cannabis was a means to an end, and it turned out to be so much more than that for me in terms of helping me avoid traditional Western medical therapies for treating back pain and low back pain, and allowed me to have my life back. So I thought, well, if it works so well for me, why not take a deeper dive in this and look at it in more detail and consider recommending it to others. And I did that and felt like that was appropriate, and about 4,000 patients later, and it's turned out to be a very, very rewarding pivot.
Awesome. 4,000 patients now have a solution. She Speaks Solutions, alternative resources, and one of the primary things that we want to zone in on is how that became a solution for you, how the cannabis industry is transitioning, and get a little feedback about what you think are some of the biggest challenges or areas of opportunities that you face as you've done this pivot.
So the pivot was a challenging time for me. I was looking at Western medical options that weren't working, and I had never used cannabis before, really, of any consequence prior to this, and just finding out how well it was working for me, I just felt like it really had serious potential. With lots more exploration and learning about the science behind it, I think it became even more meaningful and relevant to me.
You've mentioned the science behind it. Let's go to basics for some of our audience members. When you think about the industry, tell us a little bit about what you think people should know about cannabis, and what do you think we should do to start destigmatizing the concept of cannabis in the healthcare industry?
Yeah, you bring up a good point. Unfortunately, cannabis has carried lots of stigma for a lot of years. A lot of that tide seems to be reversing, and with the emergence of medical cannabis programs in more than half the states in America today, its legitimacy is increasing more and more and becoming more and more mainstream, and that's reinforced by increasing quantities of data-driven results and studies with outcomes that show the safety and efficacy of this as medicine. So, I'm from Missouri, the show me state. You got to show me with data, and legitimate Western medicine is data-driven as well. And so, some people kind of go rogue and chase crazy ideas. Well, I wanted to keep one foot firmly planted in data and reality, and as I explored this, so I always insisted that there be legitimate science and data to support my decision making and efforts, and unfortunately we have lots and lots of good data now, and I think that's important to understand is the explosion of the scientific understanding in the cannabis space is happening all around us. In fact, if I'm not reading every day, I'm getting behind. That's how I feel like.
Right.
And cannabis, literally, our understanding is exploding, and as it explodes, we learn more and more about how useful and effective and safe that it really is. And we can fine-tune our use of cannabis so that we can use it in ways that improve therapeutic efficacy and reduce or minimize potentially unwanted side effects.
So there are a lot of people in our community that have the mentality that cannabis is marijuana, it is a street drug, it is a gateway. How do you begin to change that perspective as a physician?
Through education, understanding. Pull back the curtain and really look at what it is that we're talking about. And when you really look at cannabis for what it really is, it's a plant that co-evolved. It's a stressed plant that co-evolved as humans evolved, and it biologically mimics a lot of the biological processes that happen in our own bodies. And so it's probably arguably nature's most therapeutic botanical, in that for example, the most abundant receptor in the entire brain and spinal cord is the cannabinoid CB1 receptor. And Western medicine is largely, ignoring that, which is really unfortunate. But we co-evolve with this plant, and it integrates naturally with our system called the endocannabinoid system, which is a system that has been poorly understood, wasn't even discovered until the early 1990s in Israel, where Raphael Mechoulam, who first identified THC back in the 60s, his lab continued to research cannabis in Israel, and we stand on their shoulders today. There's quite a vast abundance of research the Israelis have been doing in the cannabis space for the past 30 to 50 years or so, where cannabis has lagged in America and other countries around the world because of its designation with the World Health Organization. So as we understand how this plant interacts with our bodies, we see that it naturally integrates with our system of regulation. The endocannabinoid system helps our bodies adapt to our environment, upregulating and downregulating various metabolic and physiologic processes so that we have a better adaptation to our environment. Cannabinoid receptors quite abundant in the brain and spinal cord, as well as the organs and the immune system and peripheral nerves. Cannabinoid receptors play a big role in countless physiological processes in the body, everything from appetite, arousal, sleep, inflammation, pain, memory. The list goes on and on and on. And as we learn more about how it works and how we can apply it clinically, we find it becomes more and more useful.
Do you believe that, as you just mentioned all of those pieces, I'm immediately triggered to think about mental health and the mental health matters and identifying how we overcome and deal with mental health challenges? Do you believe that this plant could be something that could help improve some of those transitions? In fact, I guess for me, it's more of what conditions have you found that your patients have had the best results utilizing the cannabinoid?
So yeah, we found cannabis to be very impactful from a mental health standpoint. Probably one of the most common things people come seeking cannabis for help with include issues like anxiety, depression, sleep issues, PTSD symptoms essentially, intrusive thoughts, even nightmares and things like that. There's lots of anxiety, especially with COVID recently. We saw a real uptick in people who are feeling more and more anxious about the stability of their health and their economic future and where's the world going. And so we saw a huge increase of cannabis, people coming back to cannabis and turning to cannabis during the COVID epidemic. So from a mental health standpoint, probably one of the most common and useful areas where we're prescribing this is dealing with mental health issues, especially things like anxiety, depression, and post-traumatic stress disorder. The cannabinoids seem to have an inhibitory response to that anxious, stimulatory energy that seems to come out of the limbic system. And when we can sort of calm that 2-year-old in us, metaphorically speaking, we tend to be able to calm ourselves and help subdue our thoughts and relax and find ways where we can achieve more calmness internally, and that helps people sleep, it helps people with anxious feelings that can lead to depression and all kinds of things. So the usefulness for cannabinoids in mental health can't be underestimated or understated. Probably one of the most useful areas of cannabis use and research is definitely the mental health arena. And we definitely see that in clinical practice.
We were talking a little bit about the mental health effects and how much cannabis is really changing and helping our community. That leads me into a conversation a little bit more about the regulations and your perspective. Tell me what you're thinking where we're heading with the cannabis industry.
So currently in Florida, we have Florida legislature's legalized medical cannabis. So there's 13 qualifying conditions or so. You see the physician, they certify you have a qualifying condition. You get a 30-week order set, which is about half the year. Pay the state their yearly fee. That's the process in Florida. And for that does not allow recreational use or home grow provision, only medical use within the borders of Florida. So at least we have that. Some would say that's still constraining and cost burdensome, especially to the average potential cannabis user or patient that could really benefit from cannabis, like disabled veterans, for example. Find the fees associated with this extraordinary. And so there's some concern there about legalizing this and yet making it affordable and widely available. The state of Florida is a little tumultuous politically. Different forces in Tallahassee. Sometimes it seems like cannabis seems to be progressing, and then other times we see setbacks. Like recently, there was a move in the legislature to maybe propose legislation to try and cap cannabis to THC levels. That I'm not exactly sure where that is. That seems to have lost traction. Hopefully that doesn't go through. But cannabis and politics and legalities are a tumultuous place in Florida. However, federally it seems to be a little bit more organized. For example, before Christmas, the Federal House of Representatives actually passed a cannabis legalization and minor offenses expungement act and actually sent it to the Senate, and it died on Mitch McConnell's desk. Well, that's not Mitch's desk anymore.
Yeah.
And I think Chuck Schumer would probably sign it if they sent that back. And I'm sure Biden would as well. So I think, when you compare, well, where's it going, Florida versus federal, I think the feds are much more likely to pass something that a legalization bill, which I think that would even be more meaningful than Florida anyway. So we really like to see this happen at the federal level so that banking laws could change and things like that. I mean, I can imagine if the feds legalize cannabis, I could foresee or potentially foresee a situation maybe where you might even be able to go see the cannabis physician and use that on your insurance like you're seeing a regular doctor, and use your pharmacy benefits for your cannabis medicine. So a federal legalization bill I think would probably be much more impactful than if we just legalized it in Florida, because we'd still be dealing with other federal issues as we are today. So removing federal barriers and the pathway to that seems like some proposals I've seen where they reschedule cannabis from Schedule 1 to DEA Schedule 3. If we could prescribe it like codeine, for example, that would help effectualize that. We cross our fingers and hope something like that happens sometime soon. It would be nice.
Do you think that federally it's becoming more of a conversation to make those changes and make them stick? Do you think that they're listening to the people more, or do you feel like it's just more work that they need to do in order to get everything in motion?
It seems like so much of politics seems to run down party lines. And there's some, whether you're talking about state politics or federal politics, it seems like our politicians kind of vote, whether they swim upstream or downstream is like how all the other fish in their party are swimming. And there is a slight Democratic majority federally, and the cannabis movement seems to be a bit more organized in DC, ironically, than it is in Florida. In Florida, there's more the political control is more mixed, and there's more conservative influences in Florida that I think could potentially stymie significant progress on the state level.
When you think about the industry across the board, do you believe that the professional, those who are who practice medicine, do you think that they have more of an influence on being able to make the changes that we need here, like within the Florida arena? Or is it really one of those situations where once the federal level releases, then it will release everything across the board? And how do you think here in Florida we can influence that?
I think on the state level, I think the physician's voice is somewhat minimal. When this THC cap came up, the physicians definitely, I know the group of us really banded together and tried to make our voices heard in Tallahassee, though I'm not sure really how impactful that was at the end of the day. So I think with the feds being more organized, and they seem to be a bit more committed. They seem to, at least before Christmas, they were definitely more committed to it than Florida seems to be. I think our odds of getting progress there are much better than Florida.
So let's talk about, realistically, we know federally that would be a big help in transitioning, changing the stigma, and opening up opportunities. But let's talk a little bit about those who are wanting to know what they can do in Florida to obtain a medical card, to meet a physician like you. I've actually seen information, people thinking that they can go online and sign up and get a medical marijuana card. I would like to remove some of the myths about the process. Let's talk about that.
There are a number of myths and just bad information. I see it all the time on the social media message boards and just even talking to people passing in the street. One of probably the most common myth I see is the concealed carry thing. Oh, I'm not going to get my cannabis card because I like knowing I can have my gun. Well, that's not a problem in Florida. In fact, the concealed carry laws, the cannabis laws are both developed under the State Department of Agriculture, and the lady that runs that department, Mickey Freed, has been very public and forthright and demonstrating that she has both her cards, in fact. So that's a complete myth.
Myth.
It's completely...
You can own a gun, concealed weapon, and have medical marijuana.
Seems like the only issue is a federal form, I think 4473 or something like that. When you buy a gun from a licensed firearm dealer, they ask you in this form, they're screening for mental health issues and screening for situations where it probably wouldn't be a good idea for you to have a gun. And there's a question they're asking if you're addicted to any of the Schedule I drugs. And federally, they still consider cannabis a Schedule I drug. I've asked a number of people how they deal with that question because I have cannabis patients. I have one, in fact, is a firearms dealer. I asked him, he said, you have 5 ATF agents. How to interpret that question, you get 5 answers. He says, I'm not addicted to anything, so I say no to that, and I sleep well at night. I think buying a gun federally and answering that form might be an issue. You might want to consult with your attorney, but just the concealed carry part of it is not a problem, and owning a gun is certainly not a problem. And if you're not buying from a federally licensed dealer, it's certainly not a problem either. So that's a big myth. To get your card in the state of Florida, you need a qualifying condition. We can put a list of those up probably toward the end of the podcast.
Definitely.
On this one. A lot of people are using cannabis, and it really helps them with pain and inflammation. And it's a great way to limit or get away from opioids. In fact, a lot of people blame cannabis as a gateway drug, and nothing could be further from the truth. It's actually a much better exit drug than it ever was a gateway drug, quite honestly. A lot of people are finding cannabis is very helpful in getting them off opiates, off sleeping pills, off dangerous pharmaceuticals, including anti-inflammatories, which are not benign. So a lot of people are pivoting away from pharmaceuticals and medications that actually have been shown to be not good for them, and finding relief from cannabis, which is never shown to really cause any significant harm in almost anybody. So
Exactly.
there was this one study, the conservatives tout a poorly, unreproducible small study of adolescents on a psych ward, and it was a poorly designed study. It was
Adolescents on a psych ward. That's the study.
It was an adolescent psych ward
Adolescents on
where they
psych
were
ward.
using cannabinoids, and it was like an N of 8, like a very small sample size, and they concluded that it increased psychosis. That's right. This is what the conservative. This is their big study, right? Not reproducible, poorly designed study, small number, like really. So really unfortunate, because that's their banner flag to say that cannabis is bad for you. You ask any ER doc. I mean, rarely we see cannabis cause a reflex tachycardia. I've actually seen somebody pass out from using who is naive to cannabis. But, you know, when I look at patients, I mean, if they don't have an unstable tachyarrhythmia, there's just a few other things that I'd consider maybe not prescribing it for. But generally, it's safe. Very safe. Safer than most pharmaceuticals and most other substances out there that come in contact with your body. Safer than the fluoride in your toothpaste and the fragrances in your soap, that's for sure. So when you really start thinking about what to be worried about in this world, probably that's not one.
It's definitely not cannabis. It's not going to be that one.
There's an old joke that you give 5 guys a case of beer, they're more likely to start a fight. You give 5 guys an ounce of weed, they're more likely to start a band.
Exactly.
So, you know.
It has the element of enjoy.
It's really something to
and relax. And I agree. I definitely think that statistically we see a lot more challenges in other drugs. And one of the things you mentioned, 2 myths that we can clear the air on today is, 1, you can definitely get your concealed weapon and have a cannabis card. And 2, it is not the gateway drug. It is not the gateway drug. It is an exit drug. It is one that will help on so many different levels.
I'd say alcohol or cigarettes would be much better example. Probably alcohol being the best.
That one. And I think we saw due to COVID the increase of alcohol intake
and use
go beyond record numbers.
A lot of people are self-medicating with alcohol. Of course, we also saw an uptick in people self-medicating with cannabis, but when you compare it, cannabis is much safer than alcohol. I'd much rather see my patients ask me for cannabis than head over to the liquor store.
Exactly. I mean, we saw an uptick in so many areas, mentally, financially. Just so much came at one time. And one of the things that I really thought was interesting was how people were learning about the natural resource of cannabis. Can you talk a little bit about CBD and the split?
Actually, I was just going to bring up CBD because CBD, one of the things I was thinking about safety reflects back to CBD. You know, you say, oh, well, what happens if you get too high? You might get anxious or paranoid, or you might have side effects. The cool thing about using cannabis is if you ever feel like you're too intoxicated from THC, all you gotta do is take CBD and that'll more or less reverse it or reduce those intoxicating side effects. And what I recommend my patients consider is, like, when you take 3 to 5 times more CBD than THC, the intoxicating effect really diminishes dramatically. So what I tell my patients is take your THC dose, multiply by 5 or 10, use that amount of CBD, and that's going to effectively help really bring you down, so to speak, and temper that intoxication, especially if you feel like that's too much. So with cannabis, you know, we have a gas pedal and a brake. Whereas with a lot of these drugs, all you have is a gas pedal, and there's no safety, and there's no airbag, there's no brake. Cannabis is very safe. We co-evolved with it, and we've got a brake pedal.
Exactly.
And one of my favorite ways to use it is microdosing. I think when you microdose cannabis, you really unlock a lot of the medicinal effectiveness of it without the penalty of intoxication, fuzzy thinking, poor memory, lack of motivation that you sometimes see with certain forms of cannabis. So microdosing is another way to use cannabinoids very, very safely. But CBD is a great thing, and I would say the big takeaway, you know, when I think about CBD is either, in my mind, there's 2 kinds of CBD. There's over-the-counter CBD, which is unregulated.
Okay, let's talk about that.
And then there's sort of pharmaceutical or prescription CBD, that you can get from like the dispensary world that's regulated. You see certificate analysis, you can confirm it really is what it is. In the over-the-counter world, the CBD is hemp derived, and hemp is legal in all 50 states. And that's good. I think hemp needs to be legal. I think CBD should be prevalent and abundant. I think it's very useful and very safe. There's, lots of good data to support that. The problem with over-the-counter medications in America, obviously, is the lack of testing, controls, and supervision. I mean, they can put a bottle and say it's anything, right? And so what we did was we looked at CBD samples from over-the-counter sources and online sources and gas stations and things like that. And what they said was on the bottle and what was actually in the bottle varied quite significantly in so many cases that it makes one think, wow, buying this over the counter is like,
no bueno.
Yeah, rolling the dice.
Yeah,
you don't know
what you're gonna get.
Really getting it, or if you have contaminants, or it's just olive oil, or if it's too potent or under potent. So you really just don't know. Whereas when you get your CBD from the dispensary, so if you come and get your cannabis approval through the state, you can get legitimate, tested, quality assured, pharmaceutical grade CBD, then you have safety. And I think that's a good thing to consider. I'm not saying nobody has good CBD over the counter. I'm just saying you have to be very careful because there's a lot of people trying to pass off things as high quality CBD. It just isn't. And there's no kind of oversight there to ensure your safety as a consumer over the counter, whereas there is on the medical cannabis side. So something to consider.
Definitely. In every industry, you have to make sure that that you're getting what you're supposed to be getting, the authenticity, making sure that you're getting the product that's going to help you in the best way. One of the things I've learned as the industry has evolved, there's so many different ways that you can utilize cannabis. Talk a little bit about tinctures and ways that people can actually utilize THC to use as a medicine, because I know in my family, sometimes if they vape, it's too strong versus if they take what they call gels, which in our world we call gummies. That's what a balance act is about, and I kind of want to talk to my audience a little bit about those resources.
So the title of that chapter is Sometimes It's the Poison, Sometimes It's the Dose.
Oh.
Yeah. With cannabis, everybody wants to talk about indica and sativa and hybrid. There's a lot more to cannabis than just indica and sativa and hybrid. It's good to know about those things. They're all kind of ratios where you can mix THC with CBD in different amounts, because I think THC and CBD really play well together. They have a real profound synergy. The Chinese call that yin and yang, where one holds the door open for the other, so to speak. I call THC Batman and CBD Robin, where THC is a potent CB1 and CB2 receptor agonist. It stimulates the cannabinoid receptors. CBD actually binds to the side of them allosterically and modulates the function of THC on the receptor. So CBD modulates THC's feelings and effects. So when CBD is present, THC feels different. And a lot of people find that to be much more useful medically. They see reduced intoxication potencies, increased inflammation aspects, and they see decreases in anxiety as well. So CBD can be very, very useful, not only by itself, but my favorite way to use it is with THC and low doses. In fact, low dose THC CBD 1-to-1 patch is what really helped me a lot with my back pain and get me back in operating. So CBD can be very useful. It becomes even more useful when you use it with THC. When you use CBD by itself, people often ask, well, what does it do? And it does different things for different people. And a lot of people don't, honestly, they don't perceive or feel a lot of the things that it does for them metabolically. Though some people report they think the CBD reduces anxiety or maybe helps them sleep. In its pure form, CBD is actually alerting. And a lot of people think it causes them drowsy, but CBD is actually alerting in its pure form. And the CBD preparations that have what we call full spectrum, that have some of the terpenes that we see in cannabis, some of those terpenes can be sedating, so they might infer that their CBD is actually sedating when it's actually the sedating terpenes that are mixed with it or other chemicals. So CBD in its pure form is actually alerting. It's very anti-inflammatory. It's good at reducing anxiety. It's very safe. It's non-intoxicating at any dose. And when you combine it with THC, it reduces the intoxication and it extends the therapeutic efficacy of the THC. So I'm a big fan of CBD.
So it seems like they're a good tag team. That's why you said Batman and Robin.
Very much.
Because at the end of the day, you gotta have your backup partner.
Yep, they play well together.
They work well together.
They do.
Do you think that the combo, you mentioned just a minute ago that, it really helped with pain management. Do you think that combo also is just as effective with maybe the anxiety aspect, the mental health challenges, maybe even those who have even stronger challenges with mental health, like schizophrenia or bipolarism? Do you think that it helps with managing the edge of some of those?
It definitely helps manage aspects of all of those diseases. When you look at pain, part of pain involves anxiety and depression, and fear. It helps manage those symptoms. Cannabinoids are potent pain relievers as well. They can be somewhat sedating and relaxing, and certain cannabinoids are very anti-inflammatory. And when you combine all those attributes, it's a really good combination for pain. In terms of its use in other mental health, from the standpoint of relieving anxiety and improving sleep. I mean, when you improve the quality of somebody's sleep, you can change a lot of aspects of their health and their life. And so by helping people get a good night's sleep sometimes is really what's game changing. But from the standpoint of alleviating anxiety and allow people to function, it's a good thing. Some forms of cannabinoids and terpenoids are very uplifting and happy inducing. In fact, a terpene called limonene, which you commonly find in sativas, it's the lemon lime scent you get in pine sol and fruits and lemons and oranges.
Citrusy.
That citrusy scent we have found to be very uplifting and antidepressant. In fact, we studied that on a depression ward in the hospital, and you put limonene around and citrus around, and we saw depression scores improve 20 or 40%. It was not insignificant.
That's drastic.
So limonene is a common terpene you find in many cannabis strains, especially the sativas and some of the hybrids. And that could be very helpful with depression and making people just be uplifting and help with their moods. So that can be a game changer as well. So lots of different psychological and mental health therapeutic benefits from the various cannabinoids out there, that's for sure.
And that's what we're about here at She Speaks Solutions, finding those solutions that allow us to do alternative methods to improve our lifestyle. We really, really appreciate you joining us today. We have learned a lot, and I think I'm going to have you come back and teach even more.
We could talk more.
There's so much information. Tell our audience how they can learn a little bit more about becoming one of your patients.
Okay.
How they can learn a little bit about your facilities and coming on down to Sarasota.
Sure. Sure. So I'm in private practice here in Sarasota, Florida. And we're on the social media, marijuanadoctornow.com. We're 41 in Stickney Meat in South Sarasota. So we're down here, 2206 Joanne Drive. You can reach out to us through social media or through our website, marijuanadoctornow.com. In fact, all of our contact information is there. You can get information on what it takes to get through the registry and what the requirements are to be a patient, and all the information to schedule appointments and all that right there.
Well, there you have it. We are ecstatic to have had Dr. Tim Hoffmeister join us here with She Speaks Solutions and what you should know about cannabis. Thank you for joining us.
Thanks for having me.
All right, we're back to She Speaks Solutions presents Mental Health Matters and what you should know about cannabis. Our other guest today is Miss Sera Balderston. who has an amazing perspective of alternative resources when it comes to not only cannabis, but some alternative resources when it comes to acupuncture and spa and all of those items that can allow us to have better mental perspectives as we deal with our mental health matters. So Sera, introduce yourself. Tell us a little bit about you.
My name is Dr. Sera Balderston. I am a doctor of Oriental Medicine and an acupuncture physician. My undergrad's in biochemistry and molecular biology, which allowed me to really sink my teeth into acupuncture a little bit more technically than other people might understand.
It's definitely a different outlet. So tell me a little bit about what you do with your acupuncture and how it blends into your interest into the cannabis industry.
So acupuncture is a really interesting modality because it actually tunes in with the light body. So the acupuncture meridian system is an actual anatomical system that's in the body that was left out of Western medicine because they did their anatomy on cadavers, and the light system of the body is gone when you're dead. So it's a system that includes very fine filaments that run along the lymphatic and blood vessels, and they carry light in the form of biophotons. And those filaments also carry stem cells and other types of messenger molecules that help the body regenerate.
So that correlation and connection easily connects with the cannabinoid system.
Yes, because the endocannabinoid system, there are CB receptors, cannabinoid receptors on every single cell in the body. And those communicate with each other through the signaling pathways. So the light meridian system communicates with the endocannabinoid system through the stem cells.
Okay, so then that ultimately is one of those areas where Western medicine and our current medical system, they don't agree on that process.
It's mostly because they haven't really researched it that much, you know? When I introduced medical cannabis to Dr. Hoffmeister, he became a part-time medical cannabis physician here at our med spa, Point Lumino Med Spa. We were called Point Lumino before, and now we're Point Lumino Med Spa. And we went into the med spa space because it makes more sense from a holistic perspective to take care of the mind, the body, feel good, look good, and it just naturally kind of grew into aesthetics as well as cannabis. But the cannabis came on board because as an acupuncturist, we do a lot of work with pain. So when you put an acupuncture needle in the body, you automatically have an anti-inflammatory effect and you have an anti-pain effect. It feels actually immediately like less pain when you put an acupuncture needle in. And not just because it stimulates the body's natural, anti-inflammatory cytokines, and it stimulates some dopamine receptors, so you get that anti-pain. And it works really well with the cannabis because medical cannabis was actually a Chinese herb before the United States ever even existed. And then the United States decided it was bad because, it was all because of money and greed. Right?
And I was just going to ask you, what do you think would be one of the major pivotal points or areas that we can change the stigma of marijuana or cannabis, and why do you think we have such, you just said for greed, you kind of killed it.
Greed.
So
it's greed.
Well, there you go. So at the end of the day, we now realize that what Dr. Hoffmeister mentioned was how it really, really alleviates pain and is a part of the resource that we can utilize for our whole body, mind, body, which easily connects to what you do.
Right.
Tell me what you think some of the barriers are that you see as you're trying to build this company, and as the industry is changing, the laws are in effect. Give us your perspective.
So it's interesting because as marijuana, as they say, is still federally illegal, there are certain roadblocks that we find when we're looking to do advertisements, say on Google. We get a lot of pushback. We can't say certain things about what we do. We can't say things about cannabis. We can't have things on our website. We're actually separating the company. They are separate. We had to separate our cannabis company. We run all of our cannabis revenue through specific merchant services that's friendly, because the majority aren't. We've had situations where they, like for example, PayPal shut us down because they found out that we were selling CBD through through their site. And when they set it up, I thought it was okay. Like, I didn't think they had a problem with it. Well, really, they did, and they had our money, and they wouldn't give it back. They said it was going to take 180 days. It was thousands of dollars, and I ended up having to refund all of those payments and then recollect the money through a friendly merchant processor.
So you even have challenges with merchants in order to run the business.
Yep. And if you're looking for a space to rent or buy, and you have any sort of cannabis affiliated company, the banks, certain banks, most of the major banks, if for example, if the landlord of a place you're trying to rent has a bank loan with a bank that's not friendly, then you can't move in. Oh, wow. It's very difficult to find a space to rent. This space we were lucky enough to find was owned outright by a gentleman who is Canadian and didn't mind. But it's very difficult to find a place to rent. It's very difficult to have any bank loans associated. So now we have a totally separate company. The company that is the med spa is totally separate from the cannabis, and it's all set up right. But I didn't know that when I first started. I had to learn it. So it's very difficult. It's very difficult to advertise. All of our business, all of Dr. Hoffmeister's business, which that's his company separate from mine. All of that is basically just in one company on its own little island.
So you had to pivot.
And it's all word of mouth.
Look at that, word of mouth.
100% word of mouth.
So we pivoted, and now we have one entity that focuses strictly on the cannabis process, what you could do, as we spoke earlier about how to obtain your card, and you got the website from Dr. Hoffmeister. Now let's talk a little bit about your setting and making sure that we get our audience to visit the spa and learn a little bit about the services you offer for that.
So we do everything from, of course, acupuncture, Chinese herbs. We do nutrition and IV therapy and vitamin injections. What we do is we do something called functional medicine, and what we do is we test your blood. We take your blood and we look at all of the vitamins, minerals, nutrients, and hormones, and we'll make a customized protocol for you that includes hormone therapy, bioidentical only, hormone pellets, which are hugely beneficial for all kinds of issues. If you know anyone that's taking hormone shots, stop immediately. Bad. You want to do a pelleting that's a bioidentical plant-based that what it does is it mimics the body's natural hormone release. And so it's a time release. And so if you're using hormone injections, you're causing inflammation. And if you're using hormone pellets, you're reducing inflammation. And inflammation drives all chronic disease. So while we say we're a med spa, the basis for what we do is to be able to offer functional medicine. Functional medicine is so important because it's preventive versus it's well care versus sick care. So Western medicine, they diagnose way far along the disease process. And what we do with a combination of Chinese medicine and functional medicine is we diagnose when it's simply a deficiency. And that happens in your 20s and 30s. Hormone therapy shouldn't be once you get hot flashes. That's way too late. You want to be doing hormone therapy when you're in your 20s and 30s, because that's when your first hormones start going low. And everyone's vitamin D deficient. We do more vitamin D shots than anything else. And it's super important for the whole function of every system in the body to have vitamin D. So we look at what's going wrong earlier on in the disease process, and we fix it. And then we also make you prettier, because we have all kinds of fun, like cool sculpting and radio frequency microneedling for the skin tightening, and we put exosomes with that, which have your growth factors. It's all regenerative. We're not really doing stem cells because you don't need stem cells, you need exosomes. And Google doesn't like stem cells either because of the FDA. So it's exosomes, and we can do those topically. We're doing all kinds of really cool regenerative things as well.
Dr. Sera, let me get that right, is telling us a little bit more about what you can get in a proactive perspective for your health versus the reactive perspective, which we've seen in Western medicine.
Exactly.
So she gave us a little insight about some of the things that they offer at the spa. I want to talk a little bit about the hormone therapy. You were saying it's better to do it when you're in your younger age. A lot of women don't talk a lot about that reproduction system. Tell me, if I have friends that are now wanting to have kids at later ages. Do you believe that some of the hormone therapies or some of the resources that we utilize right now with your program can help as you age and it comes to that reproductive system and your body and women?
Yes, actually, we don't specialize in fertility specifically, but we specialize in anti-aging. So there you go. So vitamin D is a huge part of fertility, but it's also a huge part of the immune system. It's a huge part of mental health. Low vitamin D causes depression, for example, as well as a microbial flora imbalance in the intestines. So if your flora in your intestines are not working properly, then your whole body will not work. Your immune system, everything. If you have too much inflammation, then your body's not going to want to conceive. It's going to perceive that it's under stress. Right.
Gotcha.
So stress drives down progesterone and vitamin D, but specifically the way that stress can affect fertility is by driving down progesterone levels, because when you're under stress, the biological imperative is to not be able to have babies. Now, we are under stress all the time.
All day.
Yeah.
All day.
I mean, even driving your car down the street is more stress than your body's really supposed to take. Also, we're being assaulted constantly by toxins in our water, in our food. Stress is a toxin. So basically what happens is our progesterone levels go low, our vitamin D levels go low, thyroid, and the whole endocrine system just gets completely off. And this actually happened to me personally. I got testosterone pellets, and I feel like I did when I was 25 years old.
Shut up.
And, the way that hormone therapy was before, this new paradigm shift, even Tim, Dr. Hoffmeister, he had to go to the bioidentical hormone training in order to learn that the old way of hormones was wrong. And up until just a couple of months ago when he went to that training, he still believed that you wait until you get hot flashes and then give women estrogen. You don't give them testosterone. And that's completely wrong. And it's the way that most Western medicine thinks about hormones still today.
Wow.
It's completely wrong.
And I think that that's a great tie-in to how we are consistently evolving. I think that part of that statement literally shows that we're missing some elements, especially as you think about the cannabinoid system, and how it blends and how it could ultimately affect not just women, but also men. I think I put it in perspective because you offer a lot of pieces that allow you to kind of reverse the aging process. And I think it's important for our audience to know about the alternative resources that are available, understanding knowledge is powerful, and being able to change the perspective of what we've learned and I guess pivot into a new outlet and a new perspective. When you think about, I guess, the future of the spa, tell me what that looks like. What do you ultimately want to provide for your patients? Well,
the future of medicine, in my opinion, has to do with frequency medicine. And I envision us having a program where I'm already putting this together. So where we have a program where you can come in and actually measure the frequencies in your body and see what's off. Because on the most basic level, we're energy and light. So if you can go to the most basic level, because with biochemistry, that's what you want to do. You want to go as much upstream as you can go in the biochemical process. Well, the whole biochemical process is all overlaid on top of our light body and on top of our system, our energy systems. And those are completely not understood by Western medicine at all, but they can be measured. And so I have a scanner that I'm going to be putting into place, and then we're going to have a method for correcting the frequencies within the body. And we're going to have memberships where you can have a frequency membership and you can come in and do that. That's our next thing. And then right now we're launching more on the regenerative. That's what we're doing right now. We're launching a regenerative hair restoration with exosomes and PRP, which is where we take your blood and we make platelet-rich plasma out of it. We have a lab right next door here, that right in our office, next room over, that we can do that for you. And we can use it for hair restoration, Heath shots for the penis, makes the penis more lively, and she shots for the vagina to make it a little bit more young and vibrant. And then we're doing joint injections, and then you can do them in the face as well. So, you know, all kinds of ways to target the area that you want to be younger in, but also to do whole body anti-aging. And that's really what we're doing right now. That is our whole goal, is to get to the point where, you know, we can just keep looking better and better and feeling better. It really, when you look good and feel good at the same time, I mean, that's what it's all about.
That's what it's all about. That's what it's all about.
I mean, as I went on hormone therapy, I lost 25 pounds. Everyone's like, "What are you doing? Why are you losing
25 pounds? I might need to figure out what that's all about."
Yeah.
Okay.
Yeah, I mean, it's testosterone, thyroid, progesterone, vitamin D. I didn't know I was low in thyroid. I didn't know I was low in testosterone until I did our system here, where we draw your blood and figure out what you need and give it to you. And almost, I can guarantee almost everybody needs vitamin D, B vitamins, magnesium, calcium. We put all that in IV and give it to you, or we can give you oral supplements. So we optimize you. I mean,
to the max.
Yeah, the regular doctor is just making sure your kidneys aren't about to fail.
No, we need to be able to function.
You don't want to just know, you want to know if you're optimal.
There you go. We all want to work that way. Well, I want you to tell our audience how they can learn a little bit more about your stuff, how they can reach you, where they would go, and making sure that you leave them with your expertise, a drop of knowledge. Take it away.
So our med spa is called Point Lumineux Med Spa, because that means bright point in French. And it's all about nourishing the light and the brightness in the body, right? So it's PointLumineux.com. So that's where you can learn more about what we do and book an appointment.
We hope that you guys are realizing that your mental health is a full body process. It has to do with your mind, body, and soul. And ultimately, the cannabinoid system, it affects all of that. And these great resources are available to enhance your maximum potential. We hope that you will reach out and learn a little bit more. Thanks for joining us tonight.